This is going to be a review for the USMLE. We're going to be covering the second part of the gynecology section. These are the topics we're going to cover: PCOS, abnormal uterine bleeding, granulosa cell tumors, ovarian tumors, urinary incontinence, breast cancer, and dermoid cysts. I have no disclosures. Let's begin with PCOS. The presentation here is usually an obese female. This is the hairiest span in the world. She may have extra hair, nodular cystic acne. And what is going on? Well, here is the ovary, and you can see over here that the ovary usually has a few of these follicles developing, each at different stages. With PCOS, there are way too many. And the reason for that is because when you have excess fat, estrogen is converted in the adipose tissue in the fat, and so estrogen works on the hypothalamus, and it tells it to preferentially secrete LH, which causes the growth, but not FSH. FSH is not going to be stimulated as much, and so these follicles are all going to grow, but they're not actually going to ovulate and pop out. And so essentially you just keep growing and growing and growing these cysts, and hence the name polycystic ovary. So how would you go about treating this? Well, the first line treatment is going to be weight loss. There are other medications. You could put these patients on OCPs to kind of control the estrogen. Clomiphene citrate is another option, and that is a quick review of PCOS. Abnormal uterine bleeding. I have over here a picture of a young girl because this is commonly tested that if you have a girl 13 to 15 years old or so who's having irregular periods, parents are concerned, the patient is otherwise healthy and normal. What they're really referring to here is just an immature hypothalamic pituitary axis. When a girl first starts menstruating, the hormones are not fully in sync with each other, and so it is common to have some abnormal uterine bleeding. If a patient is over 35 years old with abnormal uterine bleeding, this warrants a biopsy. And also, don't rule out other causes for abnormal uterine bleeding, for example, blood disorders, von Willebrand factor deficiency, or polyps, which cause spotting in between periods. Regarding granulosa cell tumors, and this is found in the young and in the elderly, one of the things you'll see if it is in children, they have this advanced bone age, they can have breast tenderness, and of course, because granulosa cell tumors are secreting estrogen, the endometrium, which normally responds to estrogen, is going to grow a lot, and this is a precursor for an endometrial cancer. So what are the granulosa cells? As a quick review, this is the egg. Outside here are the theca cells, and inside are the granulosa cells. And the granulosa cells take androgens and they convert it to estrogen, and so that is really the problem here. If you have too many granulosa cells, you're going to be making way too much estrogen. Down here is a picture of CalXner bodies. Here you can see the coffee bean nuclei. This pass positive eosinophilic substance here in the middle. These are CalXner bodies. There are three main types of ovarian cancers. There are germ cell tumors, there are cells that come from the tissues in the stroma, and there are cells from the epithelial region. The epithelial cells can either secrete serous fluid, mucinous, so you could get serous tumors, mucinous tumors, Brenner tumors. These come from the epithelial cells. Commonly, epithelial cell tumors are known to cause pleural effusions, and they'll have a bumpy, irregular pelvic examination. Over here is the 125th Street Bridge in Minnesota. This crosses the Mississippi River, and this is to remind me that CA125 is used as a cancer marker for epithelial cells, not for the other types of tumors, but for ovarian epithelial tumors. CA125 is used not as a diagnostic test, but to mark the progression of the disease. Urinary incontinence also comes in all shapes and sizes. There are a few different kinds. Here's an example of when there is too much urine in the bladder, and so some is leaking out. This is overflow incontinence. Over here, the patient coughs down or bears down and pushes some pressure onto the bladder, and it leaks out, and the reason here is because the urethra, which should normally contract, is too mobile. It is not able to do its job properly. Here is urge incontinence, which is not related to your position or what you're doing. You just suddenly get an urge to urinate. It's important to know the causes of them, particularly stress incontinence. This can be caused by individuals who, at younger ages, engaged in a lot of physical exercise, putting down a lot of stress on the bladder, and the treatment for this would be a urethral sling. Very important, if you have an old person with new onset urinary incontinence, you need to get a urinalysis and culture to make sure this is not a urinary tract infection. Finally, if a patient presents with a form of a mixed kind of incontinence, where it sounds a little bit like overflow, a little bit like stress, you would have them record their symptoms in a diary so that after a couple of weeks you can look back and see which is the predominant form of incontinence and treat that one. Breast cancer, a few points I wanted to make here is that mammograms, this is a 3D mammography, mammograms are not useful if patients are younger than 30 because of increased breast tissue. The risk factors for breast cancers are old age, alcohol drinking. If you have a patient who has some breast inflammation, you give antibiotics suspecting mastitis and it doesn't get better. This case, you should suspect an inflammatory breast cancer. And down here, I have the element of tin. This has an atomic number of 50 to remind me that at age 50 is when you begin screening for breast cancer. Dermoid cysts are the last topic we're going to cover. Very commonly tested with dermoid cysts is that they have an increased risk for torsion. These, of course, are created from all the 3 germ layers. These are the ones where you see hair and teeth and all these strange things inside of them. And because they have different densities in different areas, they have an increased risk to fall over and cause torsion. That's a commonly tested point regarding dermoid cysts that is worth being aware of. I wish you the best of luck. If you have any questions, feel free to reach out to me and I'll get back to you as soon as possible.